Thank you for reminding me. All right, so I want to take a second to introduce Mike, whose video is on over here, and he is the clinical specialist, the occupational therapy clinical specialist at SimplePractice. If you want to hear about his story and how he landed this awesome position, check out the Telehealth OT podcast. We just did a recent episode on Mike's story, and I absolutely, love collaborating with him, and we've been working very closely together. So he's here to answer like any questions that I can't answer. I don't use all of the features. My practice is cash-based, so I don't use the billing. I'm going to go over a little bit of the billing, but if you have like in-depth questions about how to do billing, Mike's your go-to person. His email address is mike@simplepractice.com. If you want to put in the chat, Mike,
yeah,
that'd be great. And then, and so if you have like any burning questions that I'm not adjusting quickly enough for you, or you got to jump off or what have you, you can feel free to put them in the chat. And Mike will answer them or, get back to you. And I will do my best to, try to answer everything as best as I can. But again, keep in mind, I'm a cash-based provider. I'm a solo practitioner, so I don't have any employees. I'm going to briefly talk about how to add people as employees, to your practice, to your clinic, but I don't use those features. I use, I collect payments via credit card, and I also do invoicing for reimbursement purposes for a scholarship that reimburses me. And then what else? And it's just me, right? So very small practice. I'm not running like, huge numbers of clients, 10 at the most. But obviously SimplePractice has room for you to grow much bigger than I have and than I will for now. All right. And excuse me while I'm out of breath, because if you don't know this yet, I'm 35 weeks pregnant and it's hot. I'm going to turn the fan and I'm just going to get out of breath. So, all right, I'm going to share my screen here. Yeah, this one. Okay. So my intention again is to show you like how I use it, how I got set up with everything. Oh, you know what? Before I do that, I just want to like assess everybody who's here real quick. So if you are already using SimplePractice and just like overwhelmed or stuck, type in the chat, stuck. All right, cool. If you are just considering SimplePractice, write considering. That should be everybody else, I guess. Considering and comparing. Okay, good. If you already have your private practice set up, just write PP. You've already have it set up. You've either started taking clients or not. And then if you are wanting to start a private practice, type in like almost ready or like wanting to start a private practice. Getting there. Okay, cool. And then my last question, which I don't know if there's anybody here, but if you already have an EMR and you're thinking about switching to SimplePractice, type in switching. Okay. Oh, some of you. Okay. All right. Okay. All right. So those of you that are stuck, the reason why I had you type in those specific words is like we have your name, we have like who you are, and then either you can feel free to reach out to Mike or to me, later on if you're still feeling stuck, or we can reach out to you and we know who you are, and then also for for the rest of you, we know kind of where you stand as well, and I can target the the presentation accordingly. Okay, so let's go back to the screen share. So the first thing I'm going to talk about is how to set up your how to set up your clinic. So when you first, this is a demo account that I just set up recently. So some of the things, it's, you know, SimplePractice is really great about like having little prompts to tell you like, go here, and I kind of zip through some of those, but you'll see them when you set up your account. Also, when you start a trial, it's automatically a pro account. So just keep in mind that all these features are in the pro level, not in the basic level. So just, you know, something else to be aware of. So the first thing that you should notice is like all this toolbar over here on the side. And the first thing I go to is the settings, and this is where you're going to start to set up your practice. So I'm just going to go down some of these tabs here and we'll walk through all of them. So you want to, you know, set up like who you are. This tells you your username, your email, you know, make sure you have your business number, you want to change your password, etc. And then this is where you set up your clinic. So you can add a license for yourself, you can add your NPI number, and then it automatically has a taxonomy code, and you can select your specialist. So this would be for you know, for the owner, or for me, it's just me. If I wanted to add team members, then there's like a separate tab over here to add other people. So I could go to team member, add their name, and then add their role and add them as a team member. So this is like the basics of how to set up the clinic, and then there's more details in here for the practice. So I added my logo here. This is going to go into like auto-populate into certain documents, and so it's nice to have it there, you know, so that SimplePractice can pull into your invoices and into, you know, the statements and all that stuff. Let's see what else. And then I only do telehealth, but if there's some of you here that are doing hybrid, or if you have a brick and mortar location, then you would add what kind of office location you have here. Oh man, there are people trying to get in, but this is not the time. Sorry, everybody. Okay, so you would add your office location here. All right. So I'm going to jump back and forth, and I hope it doesn't like confuse you too much, but this is like number one: set up your clinic, set up your location, your team members, like make sure you have that down and good to go. Then to me, like maybe one of the next steps, and you don't have to do them in this order, is to schedule or set up your availability or your employees' availability. So if you go back to this main tab here, there's a option that says calendar. And in the beginning, this was like a little bit confusing to me, because I was like, well, what am I looking at here? Like, is this mine? Is this my client's? Like, whose is this? But what I like is that there's a toggle button here that shows your availability. And so when I click on availability, now it shows me, this is something that I have set up already, and I can show you how I did that. Set up my availability, and this is, again, this is Raina, this is her schedule, this is what she's available for, and you can select what times you want. And then you can also select if people can book online with me, and what services they can select, and what office, and what have you. And so you can drag this around. That's pretty nice. You can expand it. You can, you know, do whatever you want to that. And so then if you go back to, if you toggle off the availability, then those white spaces are what's available. Now I put, everyone gets Jamie D. Appleseed as a demo client. And so you can see that I put him down here because I wanted to show you how to do a video session, but you can also see that he's in gray, he or she is in gray, because that's outside of the available time, but you can still schedule. I can move him around, over, wherever. But if you notice, this little icon here is for my notes. And so that goes away if I have it in the future, okay? And this is not too far into the future, because it's like right now, and then it pops back up. The same thing with the video, I believe. Let's see, hold on. No, okay, that's still there. All right, good. So So this is what it looks like when you have a patient scheduled. And if you wanted to just add another patient, you can click on a time, you can go to search your clients and add a client there at the time. Make sure your location is selected, make sure your appropriate service code is selected. How much, this is already going to be populated, so you wouldn't have to, type this in again. All this stuff already comes up, and you just hit done, and then you've added them. So let's see, that is, okay. So let's go back to, bear with me. I was trying to see, I forgot where I set up the availability, but maybe the calendar. I have to call for my helpline here, Mike. Can you remind me where it goes to set up like my availability?
Yeah, just where you were on the schedule. Or yeah, on the calendar. So go there. Yeah, click availability.
Oh, so then I can add the person right there. Yeah, there we go. Yeah, exactly. Okay, good. So if I wanted to schedule like someone else, one of my employees, then I would have them here, and I can, type in their name and set up their availability, click whatever days they want to work, and then hit done. And so now I have Mike, and he's available on Fridays at that time. So that is how you set up your availability, not to be confused with how you set up your clients. So just remember this like toggling on and off here. Okay, another thing I wanted to go over is, which is one of the features that I absolutely loved when I first started, and one of the things that drew me, I felt like this was really nice to have on my website, is called the booking widget. And so what the booking widget is a code, and this looks like, if you haven't done your own website before, this looks like craziness to you, but essentially you would copy this code onto your website, and it would create a button that says like book now, or I forget exactly what it says, but I think it says book now. And then this is what it would look like when a client would click that button on your website. Now they can select that they want to do a therapeutic activity. They can select which office it is, and then they can select the times that are available for that activity. And so they would essentially schedule themselves and request that appointment, and then the clinician would get a notification and either accept or deny the appointment. And so I think this is really nice, especially for clients who are already registered, who already just want to schedule themselves and already know. You can also do it for new clients to request a new appointment. Personally, so if I wanted someone to set up an appointment with me, it would likely be an evaluation, and because there's like the low, mod, high evaluation, then it's kind of hard to say which one are they going to schedule for. So I may go and create just like a blank type of service that's not tied to a specific code, and so they can just use that 1, 2, 3, 4, 5 code to schedule like a blank evaluation, and then you can adjust it in the schedule yourselves after you know what level it was for billing purposes. For me, because I wasn't billing insurance, I just went and created my own codes for everything instead of using the CPT codes that are in the system already. But I wouldn't suggest you do that. I would suggest you stick to the CPT codes unless you just want to use this for like a new client, like I said, and you don't want them to choose a low evaluation or mod or high. So I love that feature of the booking widget. Let's see what else. Okay, so we'll go back to the calendar here. So now you set up your client with the appointment, and then you see the little video button here, and this is how I start my video call. So I just clicked start appointment. By now, I'll get into it, but they've already gotten their link, If they didn't for some reason, you can click share a link, and then you can copy it and then email it to them, or just send them a reminder automatically through SimplePractice. But then you would start your video appointment, and then it takes you into another window where you would start your appointment. And then the features here are muting your mic, stopping your video, or sharing your screen, and ending of the call. And then a couple of features that were recently added are pinning the video, which would make me stay in the frame, or whichever video you pick stay in the frame, over the duration of the time that it's pinned, instead of the client there. And then you can hide the participants or show them. And then if I had someone on here, you could do grid view where we're both like the same size instead of one person being bigger than the other. So this is what that looks like. And then I'm gonna switch gears here for a second, and I want to show you another feature which I absolutely love, and that is the app. So SimplePractice has two apps that you can use on your phone, and some people may think that one of them seems silly, but to me it's actually really useful, and to people that are like hardcore fans also absolutely love this. And that is their main app here, which is the one with the butterfly. And so what I love about this is that I can schedule people right on here. So I'm not going to go through all the features in this because this is actually my real account, and so I don't want to by accident like hit one of my clients and show their information. But I have made my own like demo person, which is what you see there. So I can see my schedule, I can schedule my clients, I can move them around, and then the best part is that I can actually add a progress note right from here. And and I'll go over like the notes and everything, but I use the progress note template, which is just a blank thing where I can write a whole narrative in there. And so I can start typing my note right here from my phone. So I'm like on the go and just doing a note while I'm sitting waiting at the car pickup line or whatever, wherever you are. And so I like this. I think it's like super convenient. And I've heard other people comment that they also will voice text to speech their notes on the app. And so it's super convenient and easy to like do a note. You can also choose the other templates. So you can choose like the SOAP note if you prefer that, and then go into your O and go into your S, your O, your A, your P, and write your notes like that, whatever, however you choose. And then the other part to the SimplePractice apps is a telehealth app, which is this one with the blue and the white little speech bubble there. And so this one is great because your clients can download it, but then you can also download it. And I will tell you and be honest that sometimes I'm like out and about and I don't make it to my appointment on time. I can always just like I think it's only happened once or twice, but I can always just log into my video call and get to see my client right there. Actually, sorry, this is how the client would log into theirs. So they would paste their thing on there and then join their appointment. If I'm joining from my side, I would go to the SimplePractice app and click the little video somewhere. Where'd it go? No. From here somehow I'm supposed to be able to connect, but I think, what did I do?
Is it set up as a video appointment right now?
It is. I see the video icon right there, but I don't know if it's because it passed maybe. Let's see if I edit it to now. Let's do 9:30. Video appointment. Okay, there we go. So now when I click on that appointment, it shows me the start video, and I can go right there, and then it pulls me into the telehealth app. It automatically fills that link in for me, and then I can click join video appointment, and it will do the same thing as on the computer. So here we are. So I absolutely love this. I always tell people from a telehealth perspective that you want to have a backup. This is one of my backups. You know, just like I said, if I'm like running late, or one time my power went out in my house, I can always just use my phone to log into the telehealth video call like that. Seamless, like they don't even know I'm missing half the time. So that's for telehealth. Let's see. All right. All right, Angela. Angela likes that one. Who else? Like, I'm wondering how many will you write if you are a hybrid, brick and mortar, or telehealth on here? Just curious too. All right. While you do that, I'm gonna take a second. Hybrid, hybrid, hybrid. Oh, lots of hybrids. Okay, cool. Mobile. Currently telehealth. Awesome. Okay. All right, so I'm gonna go back to the screen here. All right, so now I talked about a bunch of stuff that I didn't set up with you all yet, because I feel like it's kind of hard to choose an order of to go into with everything. But now, so now I'm going to go into like the back end of the client information, and this is probably like a big thing for many of you. I've seen a lot of questions about this, and so this is we're gonna go over now consent forms, intake forms, like what does that look like? What do you need to set up? So the SimplePractice has a client portal. The client portal is what the clients see when they get their first email. Excuse me, they log in, and they will get to see all of their documents that you need them to fill out in the client portal. They can schedule and message through there as well. I don't use a messaging feature on there, but you can totally do that. And then it also sends them appointment reminders at 24 hours and 15 minutes and it sends them their video links on there as well, through email and text once they've set up through the client portal. So, all right, so this is a client portal. This is how you set it up. There's 3 parts to it. I'm going to jump into the shared documents and files, because this is the one that I think is like the most important. And so right here, there are 4 documents that already come with SimplePractice. And so I didn't do anything to these. I mean, I did for my business, but right as you see them, that's how they come. So one is your consent for telehealth consult, one is an informed consent for OT, notice of privacy practices, and practice policies. And so you can check them on and off, whichever ones you want. You can also edit them and you can view them. So let's view one just to see, for example. So this is how the client sees it. Now you can see right here that they've set it up for you, but you need to edit it and add in your business name, address, and contact info for your practice on here, and then read through this stuff. Like if it doesn't apply to your business model, if it doesn't, or if it's something that's missing that you feel like it's missing and important, you can add to it, edit it, do whatever you want to it. But this is the basic form that they have come up with, and this is what the client sees. So if you wanted to edit it, you would go here to edit, and then it comes up right here. So I can just type right here, telehealth, telehealth OT services, yada yada. I can delete this, I can undo that, I can do whatever I want to this form. Okay, and then you could save it. Same thing for each of them. Informed consent, keep in mind, the places where there's caps, you want to change that to make sure that it reads well. And then you can, again, edit it and save it. And then you can also add other consents. So like for those of you that are doing hybrid, a photo release, a video release, social media release, whatever other kind of consent documents you want, you can add them there. And it's basically just what you saw. You would name it, and then you would just type out what it is that you want them to sign off. And they're signing off on all of this electronically, so yeah, that's why it says that on the bottom here, saying like clicking the box, I'm agreeing that I have read, understood, and agree to the items in this document. So you'd want a statement like that saying like that they're signing electronically. Okay. So now the other part of, so when they sign up and you get the appointment and everything, their first email is going to contain all of this information, as well as an intake and questionnaire form depending on what you choose. Me, I don't send them an intake or questionnaire. And I know that sounds crazy to some of you, because traditionally a patient should fill out like why it is that they're seeking services, their history, their medications, yada, yada, yada. I personally like to do that with them. And so I'll go over how I've set it up so that I don't send them a formal intake form like this one. If I was in the clinic, I probably would send something like the COVID-19 or the release of information or other ones. But as far as like a traditional intake form that has a parent fill out information about their child, personal choice for me not to do that, and then I'll explain how I kind of make up for it on the other end. But if you did want to, there is these forms, again, are already there, they're already developed for you, or you can create your own. So let's look at this is the child intake form. You know, who referred it, who's the person filling out their form, what's the language, are they being seen by anybody else, was the birth vaginal, C-section, etc., were there any complications, whatever. To me, I just think like half the time parents zip through this stuff and I don't get the information that I want or the details that I want, and so that's the reason why I'd rather go over it with them, and I don't even want to have them, you know, use up their time to fill out something if we're just going to like go over it again together. And so that's just, you know, that's just personal preference. That so their history, their developmental milestones, school, etc., and then they go through and, you know, type into these or select the appropriate field. What else? If you're familiar with Google Forms, all of these forms are basically created the same way. And I'm going to go through an example of one in a little bit, but you can see that some of the options are here. So this is a short form. So they can only fill out a certain amount of characters, right? And then this one is like a long one, so they can continue typing like a full paragraph on there. These are check boxes. They can only pick one of them, not multiple. There's an option to pick multiple if that applies. Which one? One of them was a drop-down box. The socks and shoes. So this was like a drop-down box with options. So you can create these forms. This is another thing I absolutely love about SimplePractice is you can create these forms to look however you want them to look. They have some stuff to get you started, but if you don't like it or you're used to doing other things, you just edit it and use it however you want to use it. And so I love that freedom. Someone emailed me saying that they wanted documentation that had like drop-down features with insurance approved language. And so like you create that for your employees. You create that insurance approved language, those drop-down menus for them to click however you want, like as much as an easier note or a complicated note as you want it to be, you create it how you want. So that's, you know, I think that's like one of the best features on here, to be honest. All right, so that's an example of an intake form. A parent would get that just like what we saw. They would type through it and then you would get it on the other end. You can, let's see. So you can manage your forms here, and I'm going to go over this a little bit later, but all the intake forms that we just saw are all right here. And so this is where we would edit them and where we would create a new one if we wanted to, you know, create our own from scratch. But again, I'll go over that in a second. Okay. The next part that the parents will get is a demographic form, which has, you know, their name, their insurance, and like basic stuff. And then For me, because I'm cash based, I have my online payments with a credit card already set up. So when you actually go through the motions of setting this up, it goes through Stripe, and you get charged a convenience fee from Stripe, which is like, I don't know, 2% plus 30 cents or something like that. And then that's it. Like, the payments come automatically to you from Stripe once that's already set up. So that's really nice as well. I'm gonna go back for a second and just show you, like, on the calendar, if I wanted to collect a payment from this client and I just said they're going to pay me with their Stripe credit card, I would be able to click Stripe, click how much I wanted them to charge, and then click the payment button. And this is how I do it. Before, you can do it before or after the appointment. It's actually better to do it before, in case their like card is canceled and it's not updated, and then you weren't able to charge them. You now did the whole session and you're not getting paid. Charge them beforehand, 5 minutes before, whenever you get started. Charge them right there, make sure everything's clear, and then start your appointment. But you can collect the money right then and there from the calendar, and that's the way that I do it. You can also wait till the end of the day and do it through the invoicing and all that, but this is just kind of my workflow. Okay, so where were we? Client portal. Okay. And then you can, this is the welcome message, the email that the client gets initially, and then you can also edit that as well. There's a series of emails, I'm not going to go into them, but there's a series of emails that would go out for like reminders of invoices, reminders of appointment, reminders of statements that are going out, and all of the emails are templated already for you, and you can go in and edit those to read however you want them to read. Okay, so what else? Oh, you can also add a file to send, to them, like homework or resources or whatever you want. You can add those as well, to send to them in the beginning with their like intake packet, anything you want them to read. Okay, so any questions? I haven't even looked at the chat, but any questions while I take a sip of my Coke here? Okay. Looking at my outline just to see what the next step is. Okay. Oh yes. Okay. Eileen's asking, can you add a time frame? Yes. So you can add how many minutes you want to see them on the. I'll show you. I think I was going to leave this for later, but we can jump into it a little bit now. So right here, under billing and services, there's a services tab, and here is where you have all of your services with your CPT codes. Again, these were already there, so clearly, like, this one is not applicable, I should say. You would remove that one and add whichever ones you want. If you wanted to add your own service, you can put you can put a code that already exists, or you can put in your own code. 1, 2, 3, 4, 5. Add whatever you want it to be. Add your rate and add your minutes right here. So this is where you adjust your minutes, Eileen. And the rates, Haley's asking, the rates are already set. So these rates were already there. I think I changed this one, the very first one, just to show you guys, but you can make the rate whatever you want. You can make your minutes whatever you want. And you can also, I was just showing you how to create a new one, but if you wanted to edit that, you can edit those here as well. You make it 120, you can make it 30 minutes, you can make it whatever you want. This again needs to be checked for that booking widget to work, and so you have to have it available for online booking and allow new clients if you want to have the booking widget work in sync with this. And then you can also block off any minutes before or after. So my sessions are 45 minutes long. I always block off 15 minutes after the appointment, so no one can book at like 1 to 1:45, and no one can book at like 1:45 to 2:30, because I want that 15-minute break for me for in case we go over, ideally for note taking. Finish my note, see that client, finish my note right after. I don't leave my notes till the very end, and then I have somebody else, you know, at the top of the hour. And so that's how I do that as well. These two icons are the ones, the check marks that we just went over, so allowing for online booking and allowing for new clients. All right, cool. So let's go. All right, so now let's look at documentation, and then I'll go into, I'll go back into the billing and stuff at the very end. So let's look at, okay, so this is what your chart looks like, okay?
I just wanted to say really quick,
Yeah,
you
go
guys
ahead.
are asking great questions in the chat, so I'm going to do my best to respond to each of them quickly, but keep them coming. You guys are asking great questions.
Yeah. All right. Megan, there are not home exercise programs already created for you on here, but yeah, but you can create, you can link up any kind of documents that you want, like any PDF stuff that you want. Okay. Okay, so this is what the chart looks like. And there's a lot of information here, so just bear with me. But I want to basically talk about the types of documentations that you can do on here. So you can have a diagnosis and treatment plan. So that's what you see down here. So I'm going to go and add one so that you can see what it would look like if I was starting from scratch. So if I go here, new diagnosis and treatment plan, I can select an ICD-10 code from here, whatever you want it to be. Let's see. Oops. So like autistic disorder, let's just say, you can add multiple ones. You can add like lack of coordination. You can add whatever you want. You can timestamp it. I usually like to have it timestamped to like before my evaluation time, so that's like the very first note, like on reverse order. So you would have it be to like 9 o'clock if that was my appointment time. And then save the diagnosis. Now we can go into a treatment plan, and this is where you're going to write your goals. So you would write whatever problems they were having, you would write your goals. You know, you could do like, 1, 2, 3. You can write your objectives, same way, you know. And then you're going to be able to see this from each note, and so this is really nice to have it set up again how you want to set it up, and you can have the, let me see. Oh no, okay. I was going to say, I think you can have like a one under there, but anyway, okay. And then you can put your frequency in here. So for me, that's usually 1 time a week. And then that's a timestamp again of when you're creating this. And you can set a reminder to review the plan. So if you wanted to do a progress note, then you can say, I want to review it, you know, 60 days, 90 days, however many days you want your plan of care to be. And then, so that's your diagnosis and treatment plan. So now you see it just went right here. This wasn't the first appointment in the demo, but they had done it like down here. So wherever you do it, wherever you timestamp it, that is where it's going to sit on the chart. And the chart goes on like reverse order from the oldest notes up to the newest to the top. So that's one, diagnosis and treatment plan. The second thing that you can do is an assessment. So I started creating a demo template assessment so that you can kind of see like what an assessment looks like. So this is just a sensory checklist that I got from like online, nothing formal like that you'd find in Pearson or Google Word, nothing like that. It's just any kind of assessment that you want to document on here. Then you would click through, because this is how I set up my form. Again, timestamp it and save it. So this is, and then you lock and sign it because it's like an official note. So that is the second type of documentation you can do. So now if I go here, I can, now it's signed by me at this time, and I can see my assessment. So that's another type. And then, where are we? Okay, and then you can add, if you've had an appointment, so those two you can add without a necessary appointment. The notes you need to add with that it ties into an appointment. Okay, so one thing that kind of threw me off in the beginning, and so I want to warn you all about, is that SimplePractice calls like your daily note a progress note. To me, a progress note is like at that 6-month mark, you want to do progress note, or like after, you know, a month or whatever. We used to call them like daily notes in the clinic. But so here, a progress note is your daily note. It ties into that appointment. So if you have an appointment, you saw the client, it's in the past, you can add a progress note. And there's different templates for the progress note, a SOAP note, progress note, or a reevaluation or evaluation. Like I said before, I use a simple progress note, and I just start typing my narrative here, and then I just save it and lock and sign, and I'm ready to go. And so now you can see here that I added my progress note, it's locked, and that would be my whole narrative would be sitting right there. You can do a SOAP note, you can, again, make it a clickable note, you can make however you want, and so I'm going to go over how to design your own notes and customize it how you want to in a minute. So those are the main type of notes. There's also a chart note. So like, I don't know, patient called to cancel, and then, you know, you timestamp it. This is not like a formal note. This is just a chart note that just goes in at that time. So this could be for like your non-clinical staff, to put in any phone conversations, to put in any like reminders, patients like allergic to something or what have you. There's also an administrative note. And the administrative note, it's like, it says it right there. It's like a sticky note that you put on a file. So maybe like your allergies would go here. I don't know. I can't think of like other examples right now, but that sits at the top here, like forever. It doesn't get lost in the time track and the date stamping. It sits up here. So like to me, I have to have like a student ID for the ones that I request reimbursement for. I need that student ID every single time I go request reimbursement. And so that student ID to me sits right at the top, so I don't have to go digging for it anymore. Let's see, the other parts of the chart are your billing overview, how much they owe, any outstanding invoices. If you want to collect payment, you can also do it here if you didn't do it from the calendar. The client information, their contacts, any upcoming appointments, and what else? So once your client signs the intakes, they all go right here where it says shared with client, and you can go through them and see that they signed them just to make sure. Any uploaded files that you have from an old evaluation that came over, you can put there. Anything else you can put into here that is relevant to like not a specific appointment, but just to their, you know, to their chart as a whole. And then your billing documents will go right here. So your super bill, once it's populated, it will be sitting right here in their chart. Any statements that get auto-populated, those will be sitting right there in your chart as well. And then any invoices here. So there's a couple ways to get to the billing. So we were just in overview. You can go to billing right here, and look at what's been paid and what's been not paid and how many invoices they have. And then this is where you would go in and create a claim if you were filing with insurance, or you would do your statements or super bills if they weren't already populated for you, which they're set to do at the 10th of the month, I believe. But you can change that as well. So, okay. So before I go into billing, let's now talk about like how you set up your documentation to look how you want it to look. All right, I hope I didn't miss anything in the chat. You guys scream at me if like, okay. All right, Mike's handling the chat. Good job, Mike.
Yeah, thanks everyone for bearing with me.
Yeah, take it easy on it. No, I'm just kidding. Okay, so
No,
this is where this is where you go to create your own forms and to edit them and do whatever it is that you want with them and put them where you want and how you want so that they can work for you and how you want to run your business. So again, I went to the settings tab and then I went to notes and forms. Or if you're here like lost in this menu, you're in the booking widget and you're like, where do I go? It's under documents and files, under notes and forms. Okay, so when I first started, I was like a little bit confused about this, so pay attention. There are the different types of notes first. So you have to know what type of note you want to create, right? And so remember where we went to look for a progress note. Where I was doing my client note, I was under an appointment, and it gave me the option of doing a SOAP note and an evaluation or evaluation or a simple progress note. So that is where your progress notes sit. So if you want to create a different type of note, like a drop-down menu clickable with insurance approved language for your therapist to use, then you want to make sure that you're creating it under progress note. Okay, if you want an intake form, we went over the intake forms before, and you want to be able to click which ones you want to send to your client, then make sure that they're under intake forms. If you want to set up like a checklist that you want your therapist to add to the chart for your assessments, you want to make sure you're under assessments. Okay, so I'm stressing this because again, I was like very confused in the beginning. Like I created a form and then I would go to like progress note and then I couldn't find it. And so just make sure that you know where each form is. And I think that's part of the problem that people are having, like stressing out over the documentation, because it's like, where do you put it? So just keep that in mind. Okay, there is a template library, which SimplePractice is continuously adding to. So you can always select through here, again, progress note, intake forms, and then assessments. And so you can click and you can add whichever one you want. You can view them if you know, to see if it's appropriate first. Okay, so I'm not going to go through each of these. There's a lot. And they're always growing. This list was probably like a quarter of the size when I first started, so they've added a lot. So let's go to create a new template. All right, so remember I told you which category is it going into. So right here off the bat, you want to select, is it a progress note, is it intake form, is it an assessment? And you can change this, later, but this is the key right here. You don't want to miss this. So say I want to create a progress note. So I'm just going to call it like daily note, and you can select it to the display name, whatever you want it to be. So now I can go here and add, this is like Google Forms now. You can add a question or a drop down however you want. So these are the options. The long answer, which is just like a paragraph, like a blank thing when they can write a whole paragraph. The short answer, which is just like a few words or like a short sentence. Single choice, which is, let's see. Single choice is the one where they have to click only like one of the options, so not multiple. Multiple choice is where they get the check boxes and they can click multiple options. Short answer, question groups. I don't know if I know this one. Oh, this was the drop down, like the one where you saw like independent or 75% or 50%. Or maybe that's this one. I don't use a lot of these, so bear with me, but you can select whatever you want. You can select a date, this is like a date picker. You can also add in like a section header. So if this was like the history, you can add a header about the history, and then you can also add a break. So it'll just put in a break for you. So let's just go through. I don't know, I might have to like wing this. Let's see. So for like a daily note, we can say areas addressed. I don't know. If you wanted to make, again, I do narrative, so just bear with me. If you wanted to just like have them have your therapist pick like which areas were addressed, and you could go in here and be like, we worked on fine motor, add an answer, we worked on visual motor, we worked on ADLs, we worked on, I don't know, whatever, cognitive, etc. Okay, so let's just save this. Save? No? Okay. So now the next question could be, okay, let's just say now you wanted to go into like your soap note. I don't know, we're just pretending, right? Okay. I don't know why this is not going. No, it doesn't like it. Allow one line of response. Let's see. Oh, yay. I don't know why it's not working. Let's just see. No? Okay. Well, then we'll just delete that one. Okay. So now this is the note that I created, and it's under progress note, and then we can view it. Like, it didn't do my multiple choice for whatever reason, and I'm trying to like go through this because we only have a few minutes left. But so you can see the note that you created here, and you can create it again however you want. So now if I go back to my schedule and I go back to my client and I go type a note, now I can select that note from my daily note, and then it has it right here, the options that I made. So because I selected it to be under progress note, that is why I can select it here. Otherwise, if I had done it under intake or under assessments, it wouldn't be here, okay? So let's see. And then this was the one that I was creating for the demo. So I was adding like, here's a multiple checkboxes. This is what I was just trying to show you right now. For some reason it wasn't working, but multiple choice checkboxes. This is like the category, or you can put a question in there saying like which one is applicable for the sense of touch for your child. And then these are all the things that I added to there. Require an answer for each one, save, and then, oh wait, I didn't show you. That one is under assessments, and then I just put, just titled it whatever I want it to. And now if I go to view it here, that is what the checkboxes look like. And so the client can just go through and check that, and you can make these as long and laborious as you want to. So now remember that assessments is only going to be available in the client's chart under right here, new assessment, and then that's where that one is. Okay, so an assessment is not going to be available as a part of an appointment note. So if you're creating a form under assessment, you're not going to find it under progress notes. Okay. Okay. Going back to the chat here for a second. So Haley, I called like clinics in my area, and was asking like what their private pay rates are, and that's how I determine my rates, and that's what I advise others to do. There's a big big question of like, is telehealth in person cheaper, more expensive? There are laws that say they have to be the same, and so you want to keep in mind, especially for those of you that are doing hybrid, that your rates should be the same across whether they're in person or via telehealth. And so another thing to really keep in mind is socioeconomic status. I live in like one of the richest cities in the United States, or near one of the richest cities in the United States. And so I can afford to charge more. And then I also like coach, my clients to understand their value and what they're bringing. So where I used to work in a clinic, I would never give my phone number, my personal phone number, to a client and say, call me in between visits, or like send me a video of something that's going on in the moment, or text me, or what have you. As a clinic owner, like I do that. I say, hey, this is my phone number. If you have any issues between now and then, call me. If you have any videos of something that's happening right now, or pictures, like send those over to me. And then, I can give you like kind of more live feedback instead of having to wait for that weekly visit. And so that's how I set my value, and then I can say I'm going to charge more. You can also do the same for certifications and degrees and all of that, but clients don't really care about that stuff. They just want to know how you want to help them and what value you're bringing to them that pertains to them. So, okay. Okay, is the assessment and eval form similar? So SimplePractice has set up the evaluation form under a progress note. So I actually wrote in my notes that I would probably move that into assessments personally, but again, I created my own, and so I use mine where I want it to be. So this is the evaluation that they have for you, and then there's some drop-down boxes to see what areas of focus, and then there's test names and scores and percentiles and other things that you would normally write down in your evaluation, and that is a progress note. The thing to keep in mind is that you can only select one progress note per appointment to write in, and so if you have this as a progress note, then you're not going to be able to write in your evaluation and write in a treatment note if that's what you're accustomed to doing in one appointment. So I would move OT eval into an assessment form and use it as an assessment in addition to my note for that appointment. And you can do that as well here by clicking on the OT evaluation, selecting the drop-down menu and changing it to assessment and saving that. So now you'll see that that eval went into assessments, and it's no longer an option as a progress note. Okay, let's talk about, oh yeah, someone brought up the goals. Oh my God, I'm running out of time. I hope you guys can hang out because we still have a lot more to talk about. If not, the replay is going to go out, so if you have to leave, I totally understand.
And really quick, Raina, if I could just jump in really quick. I'll keep working on the chat. If I don't get to your questions by the time the webinar is over, if you would like, I can simply follow up with you via email and give a question. But just a little background about myself really quick, because I saw a couple questions come up. So my name is Mike. My background, I'm a pediatric occupational therapist. That's my background. I've been an occupational therapist since 2011. I recently started working with SimplePractice as their occupational therapy clinical specialist. So I'm working with them to help make sure that their software is optimized for occupational therapists and it's working well for occupational therapists. So that's my background. In terms of questions about kind of support, how much support do I provide new users to SimplePractice? That's a great question. So I initially am there kind of to establish that contact and make sure you're ready to go and get you running and going. We have an awesome customer support team though that knows really, I have a good overview of the system, but we have some great customer support reps that do a really good job providing really in-depth questions. So maybe you have a lot of questions about insurance. I would be there to kind of refer you and make sure you get lined up and get that support you need. But that's a great question. And yeah, I will continue I'm going to drop my email address in the comments right now. So if you have questions or would like a SimplePractice demo, I'm happy to provide that for you. And I'll continue to work on answering the questions. But if I don't get to all the questions during the webinar, I'll make sure to follow up with you guys via email. Thanks, Raina.
All right, cool. Thank you, Mike, so much. Okay. Oh my gosh, so many questions. All right, so I usually, if anyone, I know Eileen's here from my business program, from one of the first founding members of my business program, and I usually end right on the dot. I'm breaking all the rules right now. I'm breaking my pregnancy tired mind for you all. I'm going to stay and hang out and try to answer some of these questions and go over some of these things because I was going to do that anyway, and I just didn't talk fast enough. But so again, you guys are welcome to stay. Mike, I also want to be respectful of your time, so I can save the chat if you have to go. No hard feelings whatsoever.
Yeah, no, I'll keep working. I'm up to Jen's question about
Okay.
linking the goals, so I'll just keep working down the list.
All right, cool. So Michelle was asking about showing a printed form and what that looks like. So let's go back to the client here. Okay, hold on. Let's see if there's a. All right, I think gonna go into this one. All right, so this is a note that was in the chart, and if I clicked on that appointment, I can go to download, and I don't know, are you guys gonna be able to see this? Oh, there we go. Okay, so that is what that note looks like. So it carries over. I don't have my license number in there, but had I, it would. It carries over the name, date of birth, who saw the patient, the license number, when the appointment was, the diagnosis codes, the time, and then your CBT code, and then your note. So that's what that looks like. I hope that answers your question, Michelle. All right, now let's talk about the goals carrying over. So if you want to do a actual progress note, or like I think Kim, my friend Kim was asking, like if I want to assess the goals in every single note and address them. So this is what you would do for that. So if I wanted to write, do I have anywhere to write a note here? Okay. So now I'm in the how to write, where to write a note, and I can go to diagnosis and treatment plan right here. And so that's going to pull up all my goals here, and you can copy them and paste them into here and then write like met or not met or whatever it is that you want to write. So that's kind of the solution to that for now. And you can do the same thing for like your objectives. So there isn't, as far as I know, there isn't really like a way to kind of like create a click box to assess your goals, more of, seeing them actively here and copying them, pasting them into your note. Once that's already done and you've copied and pasted them like one time, if you wanted to do it daily, then you would go into your next note and you would pull up the previous note, and then it would come up. Let's see. So you can do a load previous note, and then now those goals were already pasted in here, and now you can change this to like from not met to met, or 75%, or whatever you wanted to change it to. So that's kind of the roundabout way of assessing your goals daily if you wanted to, or on a progress note. Okay, let's see. All right, Michelle's asking about pricing. So I don't quote me on it. Maybe we can go back to maybe Mike can jump in, but let's see here, pricing. So again, I'm going over the professional plan. So all of these features that you see are on the professional plan. Keep in mind, telehealth is an add-on, and that's another $10 a month. And so you would be at $69 a month for one person. This is a solo practice. If you didn't want like online booking, or you didn't want the customized appointment reminders or secure messaging or whatever other kind of things, you can do the essential one for $39 a month plus the telehealth, which is $10 a month. And then the group practice rates are here, and that depends on how many clinicians you have. You would slide the bar across here and see what it would cost you, but essentially it's $59 for the first clinician and $39 for each additional clinician after that. I believe non-clinical staff, Mike, is that free or less?
Yeah, yeah. On the professional plan, non-clinical staff is free. So if you have a
There you go.
dedicated scheduler, biller, administrator.
Perfect. Cool. Okay, let's see what else. Let me, all right, can you do remote and mobile with SimplePractice? Yeah, you can definitely use it for both. I mean, essentially what this is these are your client charts. This is where you're keeping your files. This is where you're keeping, you're keeping everything. So it doesn't really matter what kind of, I'm talking telehealth because that's what I do, but you can totally just have your home-based appointment and, just go through that and set up like a home office type of thing. Or you can have your clinic or whatever. You can do any of the above. Which will your letterhead be on the progress note? I show the progress note and the letterhead was not on there, but it is for like invoicing and statements and things like that. You can share the screen. Does the sound come through for the clients? So I wear my headset when I want them to hear the sound, I take off my headset, and so the audio comes through like my computer through theirs, if that makes sense. I haven't really figured out a way to like do it with my headset to like, I don't know, click a setting to allow the audio to come through, but I know that they can hear it once I disconnect my headset and just play it like out as if I was talking, if that makes sense.
And really quick, Christian's question about letterhead being on the progress note, you can put in a footer for all the progress notes and all the documentation. So if you wanted to put in your company name, company address, email, website, whatever it might be, you can get that set up.
Okay, cool. Yeah, I was gonna go back and check that. I'm sure these are all the emails that I was talking about earlier. So like these are all the default emails. Oh, here we go. Documentation, include logo and include footer information. Let's see, business name. Okay, so I'm adding that. Let's see, that carries over now to my notes. It should. Maybe I have to do a new note, but let's just see. All right, so now if I download that, there you go. So you can see now here in the bottom, I just wrote business name ... So you would have your actual like stuff here, and now it added my logo. So that's what Mike was just talking about. You can add that to all of your documentation. And see, like, I don't know, like, maybe it's because I'm a techie, but like, he said something that I had no idea like what it was about, and I just like quickly found it because it's to me like so intuitive and so simple. Like, they live to their name that you could just like figure out real quick like where to go and how to add that. Okay, let's see. So the last thing I was going to go into, which again, I'm not a billing person and I don't bill, but this is like the billing section. And so this is billing in the sense of like cash or invoices or insurance. And so it's all, in one section. So if you wanted to do your insurance, you would see your claims, you would see the payments, and obviously you would be able to, do your claims through here. I don't have any of that set up. So again, I don't use this, but it all goes through the system. Let me see did I show you guys the billing part yet? No. Yeah, so you would have like your organization NPI number, you would have like all your information in there. And so when it went time to file your claims, all the insurance payers are all here. You can add your own, you can see who you're enrolled with and all that stuff. So it automatically gets sent like for you if that payer like allows for payment through like the online system, which some do and some don't. So, okay, let's see. Megan was asking about graphing the goals. I'm gonna go with no. Like I know what you're talking about, and to me, there's no way to like graph goals in this. It's more of like what I just said, just tracking by like percentages or however it is that you'd want to track them. But as far as like it creating like a actual physical graph for you, no. So as far as Haley, as far as like private pay goes, I again have my credit card goes, they get their credit card in their system like as part of their intake. If they don't have that in there, I don't see them. I address that on the phone, like make sure you put your credit card in. I cannot see you until that information is provided. I will charge, I'm in the bad habit of charging like right after the session, but again, I suggest you charge before the session. So I don't even end up sending out invoices. The invoices get populated automatically in the system. But I don't even end up sending out invoices for them to like pay me later because I've already collected the payment with the credit card like right then and there. So I'm not waiting for somebody to pay me.
Raina, can I jump in really quick? One
Yep.
thing I want to add to that I really like with SimplePractice. So my experience as a pediatric OT, I worked for quite a few startup clinics, and I was in charge of helping them choose an EMR, electronic medical record. And a lot of these EMRs, I had to schedule a demo just to see the functionality. That's not required with SimplePractice. If you
Right.
simply go to simplepractice.com, you can sign up for a free 30-day trial. You don't have to put in your credit card. You just simply put in your email address and you get a free 30-day trial with the professional plan. So you can try out all these features. And we really encourage that too. We want to make sure that it's the right fit for you and your practice. So we really encourage you to do that. And I can drop a link.
I was gonna say, no, better yet, you can use
Yeah,
my link and you can actually get 2 months free for anyone
Raina, that's perfect.
who is on this webinar and who's part of my email list. We have set up like a deal with SimplePractice that anyone who's in my audience gets 2 months free. So instead of the 30-day trial, you get 60 days free trial with you using this link right here. And again, this link will go out in the emails later if you don't get to capture it.
Yeah, but I would recommend signing up for that trial and really just kind of checking out the features. And yeah, we're happy to help answer any questions, but really getting in there and trying it on your own terms, making sure it's the best fit for you.
Yeah, I agree. And I did that as well. And I don't know if I should be saying this, but for those of you that are like maybe not seeing clients yet and you're like, oh well, like in 30 days maybe I won't be seeing clients, or in 60 days I won't be seeing clients. I actually like started the trial and then by accident let it lapse. I wasn't ready, and then I don't know how much time passed, but then I was able to like sign up again and then got really started the second time around. And so there's no pressure to be ready, but you should definitely like start playing around with it as soon as possible, because that's the only way you're going to get ready, is to like push yourself forward and to take this step, even though you're like, oh, like $60 a month, I don't have any clients. Like one private pay client at $120 or $150 for 1 hour is going to already pay for a month of SimplePractice, and you're going to have way more than one client in a month. So just like I'm coaching here. Sorry, I'm not talking about SimplePractice anymore, but like just bite the bullet, you guys, if you're still kind of just getting started. Yeah, you can use a free trial with actual clients, not just to practice and explore.
Raina, I
Um,
noticed Mariana had a question about screen sharing as well from Telehealth.
yeah,
Would you be able to, go over that a
yeah,
little bit?
yeah. So let's see. Let's go back to not that one. It has to be like there we go. All right, cool. So obviously there's no one here, but I can share my screen. So what I usually like to do is share my PDFs. And so I think I have it set up here. Okay, there it is. So I have a folder on my computer that I just have like a bunch of telehealth PDFs that I've saved, and I, will have subfolders with like client initials so that I know what we're working on. So let's just say I'm gonna do some handwriting, and I'm going to walk them through it so I can choose the little share screen button. And then I don't know if you guys can see what I can choose from on here, but I think this is this one. All right, so now this is what they're seeing, which is my PDF right here. So I can, this is like a bad example of handwriting, and so I can like move these letters up on the line where they're supposed to be and talk about what the errors are, bring the E down, bring the H, bring the L down, and show them like that. If I zoom in, it'll be, bigger for everybody to see. Make those mistakes on purpose and say, okay, what's wrong with this writing now? I can edit the draw on the PDF freehand on the PDF like this, and just write whatever I want to on there, and then they can do it along with me on their own paper at home. And you can share whatever you want. I've also just gone on Amazon and just said, hey, I think you should buy this product, and I'll just show mom or dad whatever it is that what we're talking about. So you can share anything, YouTube videos, PDFs, links, websites, whatever you want to share through the screen sharing. Okay, go back to the chat somewhere. Okay, someone's asking about better telehealth in comparison to this. So I'm not going to go over it in detail, but better telehealth is video conferencing with appointment reminders, and that's it. It's really cheap as far as because they have a per call model, and they've given, I'm an affiliate with them as well, so they've given anyone who's in my audience I think over 50% discount on the per call model. It's usually like $3 per call. They're doing like $3 per call. They're doing like 3 cents a minute, which comes out to like $1.35 for a 45-minute call. So it's really cheap for you're just getting started, but it doesn't have any EMR stuff at all. So you cannot write your notes on there. You cannot, do your billing on there. You cannot do your insurance claims. You can't do assessments. You can't do any kind of notes. So it's just video with like a schedule and appointment reminders. Okay, it's great if you have another system that you want to do EMR with. So say you wanted to just do EMR on like old school pen and paper. Don't suggest it, but some people are still doing that. That's fine. But you want to add telehealth now because it's COVID and everyone needs to have telehealth in their clinic. Then you can go and start better telehealth and keep your documentation as it is. If you don't want to switch EMRs, you're already happy with your EMR, but your EMR doesn't provide telehealth, better telehealth might be an option for you. If you're looking for like an all-in-one package, you want it all in one place, this SimplePractice is the way to go. You're welcome, you're welcome, you're welcome. I think I went over everything that was on my outline. Sorry for going over. Any final questions that you guys want to type in the chat? Even if we don't answer them now, at least we can have a record of them and we can address them later. And while you type, just gonna do a shameless plug for anyone who is looking for a business coach. I was initially, when Eileen went through the program, and I don't know if anybody else is on here, but I had a very pricey program because it incorporated a bunch of speakers who are amazing, other OTs who I was, building up and collaborating with, and that was extensive. It was 3 days a week, like you had to be there every time for 12 weeks. Because of like my pregnancy, I've decided to slow down and not run that anymore for now. But what I'm doing is a small group coaching program for anyone who's actually like set up or about to set up their practice and wants like weekly accountability. There's only 5 people allowed in each group. We meet weekly. Right now the meetings are at 9 on Wednesdays, but that group is full. So I'm going to start a new group. If anyone wants to do that, it's by application only. I really want to make sure that people are going to take action and do stuff. And so if you want to be a part of that, shoot me a message, let me know. My specialty is like tech and telehealth. So I don't, again, like if you're trying to figure out billing and how to like grow your practice and hire employees, I'm not your girl. If you're trying to figure out like technology, choosing a platform, getting your website up and running, social media marketing, creating like an online program to supplement your income, that's the kind of stuff I'm helping everybody with. So the program right now is set at $250 per month for a commitment of 6 months. And so that is, I said I was going to increase the price, but to be honest, like I don't feel like I'm feeling nice. I'll give you guys a $250 a month right now. The price is set at $250 per month. That was like my introductory price, and I was going to increase it, and I didn't want to pressure anybody into joining because I really don't. I'm not looking to like grow, but I'm still looking to help people that I know need help, like many of you that are in here right now. So if you're interested in the program and you want to apply and you want to talk and see if you're a good fit, give me a second and I will pull up the link somewhere. Okay, there's that link for that. I don't have a date of time chosen for, the next group, but I want it to be something that works for everyone. And so I have more flexibility right now, but I usually do the meetings at this time because my girls are sleeping and it just works out that way. But I think the next meetings might be more like during the day. I don't know. We'll see. So yeah, anybody else have any questions?
I think I'm just about there. There's 1 or 2 questions I'm filling up.
Okay. Yeah, I lost track. I was trying to like go back, but.
And yeah, I'm pretty sure that covers all of them. But again,
Okay.
if you have any questions, you can email me, Mike at SimplePractice. Happily answer your questions, schedule a demo, whatever you need.
Awesome. Thank you so much. I think most people signed off already, but thank you for all of you for being here. You can reach us, via email. My email is info@telehealthotservices.com. Or you can reach me via Facebook Messenger and friend request me and all that good stuff. All right, everybody, thank you so much. Mike, thank you. I really helped Amanda
Yeah.
chat there.